5 major factors that could be affecting your neuropathy that you can check for right now on your blood work. So 5 factors that could be impacting the health of the nerves in your legs and feet you can check for on your existing lab analysis. How about that? So here's what they are. Number 1, anemia. Number 2, blood sugar. Number 3, inflammatory problems. 4, thyroid. 5, vitamin D. By the way, time out real fast. Disclaimer inserted. I'm not dispensing healthcare or medical advice. Consult your doctor. This is for informational purposes only. So back to it. Let me give you some layman's discussion on how this could be affecting you. Number 1, anemia. Anemia, in short, let's say that it may be disrupting. If you have anemia present, you may be disrupting or reducing the amount of oxygen getting to cells, nerve cells, important structures. So you want to be able to rule out anemia, and it's not just iron anemia. There are more than a dozen types of anemia. Number 2, glucose. Now, we've all heard of glucose, blood sugar. Unfortunately, CDC projects that we have 45% of Americans have blood sugar problems. Yes, you heard that correctly. Unfortunately, 45% of Americans probably have glucose issues, blood sugar problems, undiagnosed diabetes, or unfortunately officially diagnosed diabetes. So we know that glucose affects nerve function and could be a cause of the neuropathy. So you want to look at that number. That'd be your fasting serum glucose, or what's called a hemoglobin A1C. Hemoglobin A1C is a 3-month window into your blood sugar, around 3 months, and it's more heavily weighted on recent days. It's a great number, also referred to as the gold standard to look at, and you'd want it in between a certain amount, and we'll skip that for this video right now. But so it's simple to assess. Number 3 would be inflammatory problems. Wow, this is really climbing the ladder of importance. There are so many underlying conditions and ailments that lead to high amounts of inflammation, systemic inflammation inside the body. And again, simple, so simple to check for. I like a minimum of 2 inflammatory markers would be great for you. 4 and 5, if you have 4 or 5 of them, that's even, you can get really detailed or specific. But CRP, even if you never heard of that, I think that's a big deal. It's usually released by liver when there's something unfavorable happening on the inside. So simple to assess, not new. Talk to your docs, whoever's ordering your blood work, get CRP done. Thyroid problems. So much to dive into there. Let's keep it simple. You need a thyroid panel. Yes, a full thyroid panel, which would probably have a minimum of 4 markers in the panel. But you need to make sure that we have good thyroid hormones being produced so we can make chemicals for nerves called neurotransmitters so we can have good nerve health, right? So thyroid, big deal. And then vitamin D. Lots of, I don't know if I want to use the word controversy on vitamin D because I really don't think that's accurate. You got to have good amounts of vitamin D. Vitamin D is kind of not really a vitamin. It's actually a hormone. The body makes it. But yes, there's vitamin form that you can get from the foods or supplements. And I think something so simple with so much research on vitamin D and ailments in general, but we're talking about nerves, neuropathy, or neurodegenerative ailments. You want to have good or adequate levels of vitamin D. Easy to assess. And for some of you, are going to be really easy to increase the level if you needed to. So, by the way, most studies say around 50. The studies that are conclusive, like what should that number be for our discussion right now, let's say 50. A lot of them say 60, but wow, we'd settle for just being around 50. So I hope this was informative. Check those 5 out. If you need help, I'm doing this live. I'm going to be going into details on this in an in-person seminar. If you want to attend, give us a call, 1-855-FIX-FEET. That's 1-855-FIX-FEET. Or if you just want me to do it for you personally, you can always reach out that way as well. If you like this information, make sure you're on our email list because I post this and send this out as information, or sometimes more detailed than this than the people on our list. You can subscribe on our YouTube channel or our Facebook page. So I hope this was helpful. Dr. Ryan K. Lewis, DC, Missouri Pain Treatment Center. Take care. Bye.